If you watch ABC News, you'll definitely recognize our next guest. Dr. Jennifer Ashton is a physician, an author, and the chief medical correspondent for ABC News and Good Morning America. She received her medical degree from Columbia University College of Physicians and Surgeons and her postgraduate training in women's health and surgery at St. Luke's Roosevelt Hospital Center in New York City. She's the author of 6 books, including The Self-Care Solution and The New Normal, a roadmap to resilience in the pandemic era. Her book, Life After Suicide, chronicles her own healing journey in the wake of her ex-husband's death by suicide in 2017. Dr. Ashton joins us live today from Englewood, New Jersey. Dr. Ashton, welcome to Healthline.
Thanks for having me. It's so good to be with you guys.
Well, it's great to see you. And so I want to just jump right in. You know, as chief medical correspondent for ABC News, you have spent much of the last 15 months or so helping people to make sense of COVID-19. And I'm curious, what are some of the most surprising things you've learned in covering the pandemic?
Well, I've learned a lot. And first of all, you know, as a doctor and a physician, I always say a scientific mind is an open mind and it's a curious mind. So it's one of the things that I consider to be a blessing about my careers as a practicing doctor and also as the chief medical correspondent for ABC is that I learn every single day. And in the last 15, 16 months, I think what I've learned is that aside from this pandemic, you know, it's so complex and multifaceted. There are so many different angles to it. And of course, it's a medical and public health and scientific story and crisis, but I think it's also a story about communication. And I learned that, you know, you can't communicate medical or scientific facts without addressing the spirit, the psychology, emotions. I think I knew that very much as a practicing doctor. I knew it intuitively because I've been in practice for 16 years and I have, I think, 4,000 patients now that I still continue to take care of. But I saw it and lived it with a ringside seat in my role at ABC News. And I'm really proud of the job that my colleagues and I have done at ABC in incorporating the spirit. You know, we're not just talking about numbers and a viral particle and case counts and, you know, positivity rates. We're talking about emotions and fear and uncertainty. And I think that really the story behind this past year of pandemic times has been one of communication and how essential it is.
100%. And I think that holistic approach is so important. And to that point, what has it been like for you personally? You're a physician and a journalist, and you can't really press pause on the newsfeed. You can't really take a break from the pandemic. And so how do you cope with that burnout and that emotional toll that it can take?
I'm tired, actually. You know, I realized pretty quickly, actually, that it was the most physically and psychologically and intellectually stressful experience I've ever been through. And I felt and continue to feel a massive sense of responsibility, not just for my friends and colleagues who I consider to be my work family, but you know, the millions and millions of people who watch us on ABC News every single day and listen to us on all our platforms. And I've heard from countless people that, you know, how important our interpretation of this story has been, that they were so scared and that we were able to help allay their fears and at the same time, not sugarcoat things, just tell them what they needed to know in a compassionate and understanding way. But at the same time of doing all of that, I also have 2 children that are my single greatest, you know, role responsibility in life. So there was, to say like a lot of juggling and multitasking is an understatement.
Yeah, I can believe it. And to that point, your latest book, The New Normal, offers a guide of sorts for people to kind of navigate those mental health impacts from the pandemic. What are some of the crucial tips that you offer for people who might be experiencing mental health issues or even post-traumatic stress as a result of this,
Oh, yeah.
year that we've had?
I mean, first of all, I don't think it's even post-traumatic stress. I think all of us to some extent have a degree of post-traumatic stress because we've all been through a trauma. We've all lost something. And, I, as you mentioned, have a very personal and profound experience and relationship with mental illness after the suicide death of my children's father just 4 years ago. And since that point, my children and I have really committed to literally thinking of our mental health and well-being no differently than we do our workout. I call it the checkup from the neck up. And I did a lot of phone sessions with our therapist over the course of the last year. I remember in particular the week after President Trump's COVID diagnosis was, the biggest story in the world. And I was awakened at 1:00 in the morning with that news and on the air constantly for the 4 days that followed. I spent the first 15 minutes of my own phone therapy session talking about President Trump's COVID, my therapist. And I thought, now I have hit rock bottom. I mean, I'm paying by the minute for therapy, and I'm not even talking about myself, and I have plenty to work on with myself. So I think, the first tip that I would say is normalize, recognize, and acknowledge that we've all been through a degree of trauma. And don't be afraid to, again, as I said, think of it as you would a checkup for your heart, or going to the dentist, and get it checked out. Do a checkup from the neck up. I think that would be my first tip. And my second tip as someone supporting someone else is when we say, how are you? Really wait for the answer. And don't just do like a flyby, how are you? But really, like, if you care enough about someone to say, how are you doing? You should care enough to really wait for an answer, because you might be helping that person more than you could ever imagine.
Yeah, you can never underestimate the power of just that space and that listening ear. And I wanted to, if I might, as you mentioned earlier, talk a little bit about your personal experience with mental illness, as you've written and spoken about so candidly with the loss of your ex-husband. And what has that grieving and healing process looked like for you and your family?
Well, first of all, I would say, we will always be healing and going through it, I believe. I don't know that anyone who loses a loved one to suicide ever is through it or over it. And I think that there are days, that my children are 21 and 22 now. They were 17 and 18 when Rob died. And it's, I'm sure they have their hard days, but they live every day in a way that honors his spirit. And they're aware that mental illness can strike anyone and doesn't discriminate, and that optics can be deceiving. And I think I'm glad for that. I'm glad for that awareness that they have now. And for me personally, there are times that I feel like the strongest person in the world. And then there are times that I feel like the weakest person, and I feel, permanently broken from that. And then there are times that I feel like it was, in a weird way, a gift that Rob gave me, in that I was able in a lot of ways to experience some post-traumatic growth and see my life through a different lens of appreciation. So, I think it runs the gamut. And I think that, it will always be there. And I think it should always be there.
And I'm so sorry for your loss and your family's loss, but I'm so grateful that you are talking about this, because sadly, I think it's something that it touches a lot of people, and it's very difficult to talk about. It's still kind of taboo. And so in your personal experience and in your opinion, how can we have better conversations about suicide and suicide prevention with our families, with our communities?
Well, I mean, I think the first way, I think it is slowly getting better, because unfortunately it's become such a pervasive epidemic, really, that it's affecting so many people. So I think that is one bit of encouraging news. But I think, something that I've said many times, both on the air and privately, is that, when we raise children, we teach them from a very early age how to dial 911 if they see a fire or if someone collapses and needs an ambulance. And I really believe that we should be teaching our children at the same age the 1-800-273-TALK lifeline number, or the 741-741 text lifeline number. And I believe that we should be teaching them, certain lines, like, no matter how bad things may seem, no matter how much pain you're in, there's always hope. There's always help. You're never alone. Things will get better. And I think that everyone needs to hear that. And so I really believe that we need to start that at a very early age. And that's just kind of in our society and as parents. But I think that also in the medical community, doctors like myself, who, I'm an OBGYN, I see women head to toe, I'm their primary doctor. We all in the healthcare space need to ask about mental health every single time we see a patient. Right. So I think everyone has responsibility in this.
Definitely. And I think, like you said before, we're treating it like it's any other, health check-in. Yeah. So really normalizing that. Thank you so much.
Dr. Ashton, Steve Swayze here. Thank you so much for your advice. The checkup from the neck up, a great soundbite and well worth thinking. So many other valuable things. Erin, thank you for talking with Dr. Ashton. But before we leave you, Dr. Ashton, we want to congratulate you today. About an hour ago, you and GMA3 are nominated for two daytime Emmys. Two is a lot. 2 daytime Emmys for you for outstanding informative talk show host. So congratulations to you and to GMA3. Thank you for joining us today.
Thank you so much, you guys. And I give kudos to my amazing team and colleagues and our viewers at ABC. We're really honored with the nomination.